Missouri expanded Medicaid qualifications last year, and it's making a significant difference this year on a local level. Our Alex Simone has the exclusive story.
It started slowly, but the number of residents using Medicaid has taken a significant jump from last year. Buchanan County Social Welfare Board Executive Director Linda Judah says that before expansion, around 15% of patients were on Medicaid, but now it's up to 37%.
Remember, it was very difficult to get on Medicaid, and so we would commonly hear, well, I've tried, several times to apply for Medicaid, but I was always rejected. Well, now, suddenly, Medicaid has expanded.
The trend is holding true for Buchanan County and the state as a whole. According to the Missouri Department of Social Services, there are about 1.4 million people currently on Missouri Medicaid. That's compared to 1 million last year and less than 875,000 in 2020. Now in Buchanan County specifically, there are about 23,500 currently on Medicaid, as opposed to 17,500 in 2021 and 14,500 2 years ago. Northwest Health Services Eligibility and Enrollment Coordinator Michelle Davis-Reed says the loosened regulations have greatly increased how much money families can make while still qualifying.
The family of 3 could make around less than $400 a month for the parent to qualify. Now, if it's a family of 3, is over $2,500 a month, and the parent can still qualify. So that's a huge, there's no comparison. You can't compare that.
Another part of the shift could be due to a change in perception. Resident Devin Delaney has been enrolled in Medicaid more than a decade, which is a necessity due to his seizures that carry a significant physical and financial burden. He says accepting assistance can be its own challenge because it means people are admitting they need help.
Hopefully they have a family in place, a support system. If not, the resources there at social services will help you get in touch with those people to help you do that. A lot of that stuff I had to do on my own. I felt ashamed of who I was and what I was doing, and didn't want to be a burden on my family. I know that's a big thing for a lot of people, is they don't want to burden their family by what they're having to go through.
The approval process was taking upward of 90 days for many Missouri residents last year, but it was supposed to take no more than 45 days. Now, many people can be processed in a couple of weeks. Davis-Reed says one of the biggest differences is having an electronic catalog to input patients' information and speed up the time frame.
In the past, you would have to take your paycheck stub in, and some people have a hard time getting a paycheck stub, or they don't know how to get it, or they don't take it in, they forget. Now, Family Support Division can look it all up. Oh, it's saved our lives a lot with the applications, and it just speeds it up.
Kim Evans, who's the director for the Department of Social Services Family Support Division, says the number is expected to take a leap again when the federal public health emergency ends. Because of the COVID-19 pandemic, residents haven't had to re-enroll for Medicaid. Once the health emergency is terminated, annual renewals will become a requirement again, which is why Evans says the number of applications is expected to take a massive jump in the future.
Folks need to know that they have to do an annual renewal. It's been 3 years since they've done one. And some people have come on new and really do not understand the process that they need to do to be able to keep their Medicaid ongoing.
Qualifying still can be difficult because Medicaid might not always reflect the wage level of the people who need it. The limit for a single-person household to qualify would come out to around $9 an hour for a full-time employee. Minimum wage in Missouri is just over $11 an hour. Delaney says it can feel like having to decide between working or receiving medical assistance.
If you make too much, then you won't qualify, but then you're going to have to pay all of your medical expenses and your medications and your doctor's visits and everything, and that will actually, if you do that, put you below the poverty line. A lot of people really go through that.
For News Press Now,